everyone, my name is Amrita. I'm a rehabilitation and pain medicine specialist and also the new fellow representative on the Faculty of Pain Medicine Board. And I'm here today joined by Professor Alan Finlay, who has a long list of achievements and accolades, which I won't mention, otherwise I won't have time. So very briefly, he's a pediatric anesthesiologist who has over 30 years experience in pain research and management. He's also a professor of anesthesia, pain management and perioperative medicine. Yeah. So thank you for joining me, Professor Finlay, and welcome to Cairns, Australia and ANZCA ASM.
It's a pleasure to be here. I'm delighted to be in Cairns.
How are you finding it so far?
Oh, lovely. Beautiful weather up to today, but we've been
Yes.
inside today, so it didn't matter.
Hopefully we get some sun soon.
Yeah.
So you just gave us a very interesting and impactful presentation on a global perspective to ensuring pediatric pain care. So I'd like to start off with, so just you have a few different projects you're involved in and you've had a very long career so far. What drives you? What is your why?
It's hard to say. I mean, I think many people can trace their start in a certain career area to one event or one patient. And that's what happened to me. I was sort of interested in pain when I was going through residency training, but there was no training in pain at that time. And I was in practice in pediatric anesthesia and gave an anesthetic to a little girl with cancer and realized that she was really in severe ongoing pain. And in 1989, nobody really had any good ideas about how to manage that in a 4-year-old. So I made some suggestions which were just kind of off the guesswork almost, and that seemed to help. I came back the next day and things were a little better, and then I came back the next day and said, give me a consult request and I'll look after it. And I followed her for 6 weeks, got her home for Christmas and New Year's with her family, and she died shortly after New Year's. And she changed my life. And realizing what could be done and what should be done just kept me going all this time. I loved being a pediatric anesthetist, but increasingly over the years doing more and more with pain management and pain research. And now I don't do any anesthetics, but I'm still doing clinical pain and research. The global health stuff kind of started by accident as well. And meeting somebody, talking to somebody, getting invited to go somewhere, and trying to develop programs that would work in different settings and different resource levels.
Yeah, just kept going since then.
Just kept going, you know.
Thank you for sharing that.
Yeah.
My next question is, so you mentioned in the talk that there's obviously a few challenges with pediatric pain medicine. What would you say some of the challenges are?
The long-term challenge has always been getting a level of awareness. I would say that 20 years ago, traveling around the world, people would say, what do you mean children have pain? 15 years ago, they would say, gee, I don't know. 10 years ago, they would say, yeah, children have pain, but we don't know what to do about it. So there has been this improvement, this level of awareness has come up over the years. But people often feel that they don't know what to do, or they don't know where to go, or they can't get the time or the resources to do the job. Getting administrators and funders and so forth to recognize that this is really important and that it makes a difference to lives is a challenge, particularly in settings where resources overall are limited. And trying to decide where you put the time, where you put the people. You don't necessarily need expensive, fancy equipment. Anesthetists like working with expensive, fancy equipment, but you can do the vast majority of what you need to do with very simple things, non-pharmacological approaches, oral, and so there's nothing really to stop any setting from improving their care, their pain care for children, except the knowledge and the will and the resources. So those are the challenges. I mean, they apply in adult pain care as well in different parts of the world, but children are one more step, you know.
And what would you say we should be doing more of, we should be doing better with regards to pediatric care?
We need hospitals, governments to recognize pain care generally, and from my point of view, children's pain in particular, as a public health issue. So it needs to be covered by universal health coverage. People shouldn't have to pay to get pain care. The resources need to be available, and they need to be multidisciplinary. Physicians and anesthetists don't have all the skills they need. We need nurses, we need psychologists, we need physiotherapists, we need social workers to manage all the different aspects of complex pain. And in the hospital setting, when you're talking about acute pain, you need the surgeons on board, you need the unit floor nurses on board, you need the administrators as always on board to understand the importance, understand that if you provide good pain care, if you prevent pain whenever you can, and you manage it if you haven't been able to prevent it, patients will do better. They will recover faster, they will get out of hospital faster, they will have less complications, they will die less often. And I often say that because pain is everybody's problem, it becomes nobody's problem. If you have a heart problem, that's cardiology, and they understand that that's their problem. But pain applies to everything, and therefore it's hard to get everybody to recognize that it's part of what they need to do. Does that make sense?
Yeah, beautifully said. Thank you for that. So on with the final question. So if you have a pain medicine trainee watching this video right now, or trainee who wants to go into pediatric pain training, what advice would you give them?
Have fun. It's, it is incredibly rewarding. You go see a child who's post-operative and suffering in severe pain, and you do something, and all of a sudden they're sitting up and smiling. That's a huge lift. There's nothing feels better than that. I'm an anesthetist by training, so I'm used to giving a drug and seeing an effect in 2 or 3 minutes. And when I started doing chronic pain, that was a real mind shift for me, because all of a sudden I was saying, well, give us a call in a month or 6 weeks and let us know what's happened. That's totally outside an anesthetist's mind frame, right?
Yeah.
But, the first year I had 5 teenagers who had been out of school for months, sometimes years, who all graduated and went on to university. That was a rush. That was exciting, because that was a huge change in their lives. So all aspects of pain can be very, very rewarding. Needless to say, nobody goes into pediatric pain management for the money, but there are more important things than money. So
That's very true. Yes. Well, it sounds like it's a very rewarding job, and you enjoy it. You're very passionate about it.
Yeah.
Obviously. Yes.
Keep on going.
Yes. Yes, you do. Well, all the best. It was lovely to meet you, and thank you so much for joining us today. Thank you for your time.
Pleasure.